Welcome back to a brand new video of Pearls of Medical Nutrition, and the topic of discussion is scurvy. Scurvy is the name for a vitamin C deficiency. It can lead to anemia, debility, exhaustion, spontaneous bleeding, pain in the limbs, and especially the legs, swelling in some parts of the body, and sometimes ulceration of the gums and loss of teeth. Scurvy has been known since ancient Greek and Egyptian times. It is often associated with sailors in the 15th to 18th centuries when long sea voyages made it hard to get a steady supply of fresh produce. Many died from the effects. It also occurred during the Irish potato famine in 1845 and the American Civil War. The most recent documented outbreak was in Afghanistan in 2002, following war and a drought. Modern cases of scurvy are rare, especially in places where enriched breads and cereals are available, but it can still affect people who do not consume enough vitamin C. Here are some key points about scurvy. Symptoms of scurvy result from severe vitamin C deficiency. They include bleeding sores, tooth loss, anemia, and a reduced rate of healing for injuries. It can be fatal if left untreated. Scurvy is treatable with oral or intravenous vitamin C supplements. Vitamin C is needed for making collagen, an important component in connective tissues. Connective tissues are essential for structure and support in the body, including the structure of blood vessels. A lack of vitamin C will also affect the immune system, absorption of iron, metabolism of cholesterol, and other functions. Symptoms. One of the most notable symptoms of scurvy is the loss and damage of teeth. Vitamin C is a necessary nutrient that helps the body absorb iron and produce collagen. If the body does not produce enough collagen, tissues will start to break down. It is also needed for synthesizing dopamine, norepinephrine, epinephrine, and carnitine needed for energy production. Symptoms of vitamin C deficiency can start to appear after 8 to 12 weeks. Early signs include a loss of appetite, weight loss, fatigue, irritability, and lethargy. Within 1 to 3 months, there may be signs of anemia, myalgia, or pain, including bone pain, swelling, or edema, petechiae, or small red spots resulting from bleeding under the skin, corkscrew hair, gum disease, and loss of tooth, poor wound healing, shortness of breath, mood changes, and depression. In time, the person will show signs of generalized edema, severe jaundice, destruction of red blood cells, known as hemolysis, sudden and spontaneous bleeding, neuropathy, fever, and convulsions. It can be fatal. Infants with scurvy will become anxious and irritable. They may experience pain that causes them to assume a frog leg posture for comfort. There may be also subperiosteal hemorrhage, a type of bleeding that occurs at the ends of the long bones. Animal studies have showed that vitamin C deficiency in a woman during pregnancy can lead to problems with fetal brain development. The main cause is an insufficient intake of vitamin C or ascorbic acid. Risk factors. Not getting enough vitamin C is a cause of scurvy. To prevent this, get a healthy amount of vitamin C from food sources such as oranges and fresh fruit. Humans cannot synthesize vitamin C. It needs to come from external sources, especially fruits and vegetables or fortified foods. A deficiency may also result from a poor diet, lacking in fresh fruits and vegetables, possibly due to low income or famine, illnesses such as anorexia, and other mental health issues. Restrictive diets due to allergies, difficulty orally ingesting foods, or other reasons. Older age, excessive consumption of alcohol, or use of illegal drugs. Late or unsuccessful weaning of infants can also lead to scurvy. Treatment. Treatment involves administering vitamin C supplements by mouth or by injection. The recommended dosage is 1 to 2 grams per day for 2 to 3 days, 500 milligrams for the next 7 days, and 100 milligrams for 1 to 3 months. Within 24 hours, patients can expect to see an improvement in fatigue, lethargy, pain, anorexia, and confusion. Bruising, bleeding, and weakness start to resolve within 1 to 2 weeks. After 3 months, a complete recovery is possible. Long term effects are unlikely, except in the case of severe dental damage.